Prakash Malhotra from Calcutta. Like I told you, I was staying here. I moved back to Calcutta. And I developed this pain in the month of January because I had a small accident in my factory where I fell off a bus during inspection. And as the months went by, the pain started becoming worse and worse.
Where was the pain?
In my neck. I think C4, C5. I had my MRI done. Before that, I had no idea that I had cervical spondylosis, and showed it to a lot of doctors in Calcutta. And basically, they gave up on me, saying that you have to go in for a surgery. And when I spoke to my brother here, he recommended this doctor, Sugam Hospital, who is supposedly the #1 surgeon in India. So I came to Chennai, met Mr. Hegde with my brother, and was convinced again that I need surgery and there is no way out. And within 4 days of my surgery, I would be fine, going back to my regular life, as in playing badminton, which I do every evening. So one evening when I was home, there was a friend, a very dear friend, who just visited me, told me, "Why have you come to Chennai? What brought you to Chennai? Work, pleasure, what?" I said, "Pain." So at that point, he told me, "Have you gone to Mr. Anant Jyoti?" I said, "I have been to a lot of Jyotis and Joshis in Calcutta, and which really didn't help. So I'm going in for my surgery in about 4 days. This is what I've decided." So he said that he was also suffering from the same problem. I said, and especially when you go through this pain, you think you are the worst case scenario, and no one can take pain the way you have. Anyways, he convinced me that I should come and visit Mr. Anant Jyoti. My brother called Mr. Anant Jyoti and he was kind enough to give an appointment. And at that point also I was not very convinced. I came here for getting treated. I had time to kill, so I said, "Okay, let me visit Mr. Anant Jyoti." That fine morning came, we met Mr. Anant Jyoti, and without looking at my MRI, he told me it is C3, C4. Like Mr. Anant Jyoti always says, all he does is he plays with his hands. He does not use machine tools, anything. What actually convinced me to not to do surgery and to follow this therapy was when he just told me one thing, that I am not trying to cure your pain. I am trying to cure the mechanism of your body. There again I was not convinced. He made me stand up and he said, "Fine, you do go ahead to your surgery. I am not stopping you to do surgery. But to begin with, your posture is wrong. So if let's say it's C4 and C5, you have your surgery done. But because of your posture, what after a year it is C6 and C7. That was the thing that convinced me. That to begin with, my posture was wrong. And got convinced and started the therapy, and yes, I would say I have improved. About a week back when I sat with Sir, and he asked me one thing again, "According to you, Prakash, how much do you think is your recovery?" I said about 60%. And Sir said, "No, I think let's keep it 50-50. So, when you hear that from a doc, then it gives you that kind of mental satisfaction also. You need that, that's very important, I feel. Because besides Sir doing his therapy on me, I need to make that approach, that effort even from my side."
So did you go through the surgery?
No, I'm sitting right here without surgery, and went recently to Calcutta and took a lot of brochures, took a lot of cards. Because when you're going through that pain, you want to share it. If I was not going through this pain, even if I would have got brochure from somewhere, even if Sir would have given me, it would have just been there in my cupboard or my suitcase. But having gone to Cal, I think I have not distributed his brochures and cards. I've distributed my pain.
Has your pain subsided?
Oh yes, it helps.
How is your activity now, and what are the course of treatment you underwent here?
Here to start with,
Here, what are the awareness you gained from here? You are starting from your posture, you're sitting, you're sleeping, and what changed you?
time and again I check myself. Like very important, sir said that, Mr. Jyoti said that, like let's say when we eat, we have that tendency of going to the food. He said you sit back, sit up straight and let the food come to you. So now each time when I eat, I check myself. Initially we keep doing that. Now I make sure, though I feel that it's an awkward position, but I've got used to it. I make the food come to me instead of me going to the food.
3 months.
That, and then there's a lot of core exercises, breathing exercises.
Monday.
And from last week, I've started hydrotherapy. A lot of exercises in the water, which is very comfortable for me, because since I was a child I was swimmer. So that has also really helped me develop my muscles from within, which was weak.